Good afternoon, everybody. Welcome to our June VMFA meeting. To kind of kick off, I'll just kind of go over our objectives of the VMFA group. We are here to identify gaps, opportunities, and barriers in service to improve service for veterans and military families, coordinate information on services for veterans and military families, and educate veterans, military families, and community advocates on community-based efforts in suicide prevention. So we meet every month on a rotating or to cover rotating topics. And today we are covering health and healthcare available for veterans and their families in the Triangle area. So we have 4 panelists joining us today with a wide range of services. It'll be a really great conversation. But before we get into that, we're just going to go around the room. Please say your name, who you are here representing, and your military affiliation. And I'll start. My name is Landry Young. I'm the marketing outreach manager here at the Joel Fund, and my military affiliation is my husband, currently serving. I'll pass it off to you. We'll go counterclockwise.
Okay, perfect. Hi, I'm Anna Garst. I'm Brooke Dickart's the executive director assistant, but I work with the rest of the Joel Fund team. My main military affiliation is through her. We've known each other since I was really young, so that's the main thing. But my great aunt and my grandpa also were involved in the military.
Thank you. I'm Brooke Dickhart, executive director of the Joel Fund. And my military affiliation is that I started all of this in honor of my dad, who was a Navy SEAL. So.
Hi, I'm Jackie Sinicrope. I work at Transitions LifeCare, formerly Hospice of Wake County. I do education and outreach in the community. My personal affiliation with the military is my dad was in the Army and my grandfather was as well. And then we serve veterans at work. So.
My name is Catherine Bumgarner. I'm the operations manager at Community Workforce Solutions Brain Injury Department. And my connection to the military is both of my grandfathers are veterans from the Air Force, and my father has been a civilian in the Navy for 4 years.
I'm Talia Burke, Marine Corps veteran. I'm here on behalf of Veterans Bridge Home.
Daryl Macaluso, I'm an Army artillerist back in the days, and I'm with the VA, Home Health.
Daniel Roberts, President and CEO of Moral Injury Support Network for Servicewomen Incorporated, and I'm retired Army.
My name is Bill Bryant. I served in the United States Marine Corps. Now I'm served in the Joel Fund as an ambassador.
Thank you. Okay, hold on. So I'm gonna just show up. Okay. Next, we have Brianne.
Brianne Lyda McDonald. I'm project director at the North Carolina Institute of Medicine, and my father and grandfathers were in the Air Force.
Thank you. Isabella.
Hey, I'm Isabella Brzezinski. I'm the Operation Art Program Manager at the Joel Fund, and my dad is a retired Army veteran.
Thank you. Talia.
Hi, everyone. I'm Talia Wanee, the Client Engagement Manager at Roger or Stop Soldier Suicide. I had a father who served in the Navy, a sister who recently just separated from the Navy, and another sister and brother-in-law currently serving in the Navy. So big Navy family over here.
Love a Navy family. Ross.
Hey everybody, Ross Yeager, Director, Wake County Northern Regional Center. My father served in Korea, my brother served in the Air Force, and delighted to be here. Thanks.
Thank you. Jamie.
Good afternoon, everyone. My name is Jamie Upchurch. I'm the Women Veteran Program Manager for the Durham VA Healthcare System.
Thank you. Paul.
Good afternoon, everyone. I'm Paul Berry, retired Marine with Veterans Bridge Home here in the Triangle, and it's just good to see everybody. Some faces I haven't seen in a while. Talia, it's good to see you.
Thanks, Paul. Carla.
Hey, good afternoon. I'm Carla Jackson. I am a Navy veteran. I come from a long line of Navy veterans, Air Force veterans, Army veterans, and I am the Veteran Services Supervisor for Wake County Veteran Services.
Thank you. Randy?
Good afternoon, everyone. I'm Randy Silver. I'm an Army veteran. I'm with NC Works Career Centers. And good afternoon, everyone.
Good afternoon. Thank you.
Awesome. So we have 4 panelists joining us today. We have Dr. Daniel Roberts, the president and CEO of the Moral Injury Support Network for Servicewomen. We have Daryl Macaluso.
Yes.
Got it right. Okay. Whole health partner with VA Whole Health. Talia Wanee with she's the client engagement manager with the Roger Wellness Program of Stop Soldier Suicide, and Jackie Sinicrope, yes, with community engagement and outreach education for transitions LifeCare. And I apologize, Jamie, I didn't quite just know if you were coming today, but please chime in if you have any additions to the conversation.
Sure.
All right, so we'll just kind of get started. Dr. Roberts, I'll hand it to you first. Our first question is to explain your role within your organization and how you serve veterans.
Okay, yeah, so I'm in charge. Basically, executive director, I like the term CEO, so I picked that when I founded the company. But we, our main effort is to support women veterans who are recovering from moral injury or experience a moral injury, which is a traumatic event that happened during their service that violated their deeply held sense of moral beliefs. And we do that 3 ways. We conduct research on moral injury issues. Our current research project is looking at moral injury in military spouses of service members with PTSD. We do training and education for care providers like chaplains, social workers, psychologists, and so on about moral injury. And then we provide direct support to women veterans by helping them find resources, provide counseling and that sort of thing.
Thank you. Does anybody have any questions right now about what moral injury is before we continue on? Okay, let me make sure. Daryl, please explain your role within your organization and how you serve veterans.
I'm the whole health partner at the Durham VA, and I kind of do the classes for whole health and encourage veterans to start taking charge of their lives and start coming to the VA for wellness and not just illnesses. A lot of people don't use the VA, they usually just go for their primary care and don't use complementary integrative services like yoga, tai chi, massage therapy, chiropractic care, mental health. So I encourage veterans to do that. We also do a couple of classes and group things. For instance, I do intro to whole health. Intro to whole health kind of makes veterans aware of all those stuff, and actually and I become kind of their partner. That's why it's called a whole health partner, trying to connect veterans to things they can't find. One thing about the veteran community, and the reason why we're all here, is that it's asking the right questions to find the right, because there's all different programs in the VA, outside the VA, and it's just knowing the right question to ask to connect. And so I kind of act like that connector.
That's great. That's like that proactive approach. You're not just going to the VA when you're ill, right?
Yes,
Yeah,
yes.
that's great. Awesome. Jackie.
Okay, again, Jackie Sinicrope, and I do education in the community. I do outreach, engagement, trying to just educate people more on hospice and palliative care and helping people to sort of dispel any myths, surrounding that. So we do offer hospice care. Most of our patients are in their homes, so we do that there. We have palliative care, which is a consultative service. We try to get people to understand more about getting on that earlier in the disease process when there's chronic illness or serious illness. We also have an inpatient unit, so we have 30 beds where people can come if they have unmanaged symptoms. So that's that for in terms of like our healthcare services as far as veterans. So we're a nonprofit. We serve everyone regardless of the ability to pay. So we are always welcoming in anyone, no matter whether they can pay, whether they have Medicare insurance. And then we have veteran volunteers. And so every time a veteran comes on service, we do a ceremony where it's the NHPCO, we honor veterans. And so we go out, we do a small ceremony, a veteran comes along, presents them with a flag and a pin, and then we make sure to connect patients with a veteran volunteer who can come out and be their person to kind of reminisce or talk and just sort of have that better understanding. So wonderful, thanks. Yeah, and then last thing I'll say, we have we do have a memorial on site. So we have all of the branches represented, even Coast Guard and Merchant Marines. We do Memorial Day services, and families can come there and do services. So
Wonderful, thank you. Thanks. And Talia.
Hi, so I am the client engagement manager. I oversee a team of 5, and I like to describe us as like the first line of defense when clients are reaching out to our program. We are gathering their demographics, kind of assessing their resourcing needs, and we're scheduling them to get connected to one of our licensed clinicians in the states we serve.
That's wonderful. Could you explain more about, because Roger is a little new, right? Could you explain more about that program?
Yeah, absolutely. So it's not super new. It was a bit of a rebranding we've done in the last couple of years. So we're still part of Stop Soldier Suicide. Our main focus is mental health and suicide prevention, intervention, and ultimately de-escalating someone's suicidality. And we like to take a 2-man approach is the way I describe it. We have somebody who's a non-licensed clinician who's assessing the client's needs, whether it's connection to resources in their community. And then our licensed clinician is doing an evidence-based modality specific to suicidality. So we currently do CAMS and BCBTSP. I don't have a clinical background, so please don't ask me exactly what they are. But we have clients stay with us anywhere between 6 weeks to 9 months. And I have a little PowerPoint if I can share it later, or I can share the slides with you guys as well.
Yeah, absolutely. We can save some time at the end for that.
Okay.
Okay, my next question. So Dr. Roberts, do you only serve women veterans? Do you serve women that have worked in the National Guard, the Reserve?
Yeah, so anyone who identifies as a military woman, either currently serving in any of the branches, including the Coast Guard, National Guard, Reserve, or who did serve in any era, and regardless of discharge, we recognize that a lot of women were discharged unjustly. Because of a moral injury caused behavioral issues that then got them discharged with a less than honorable, when the real problem was the thing that was perpetrated on them, not their behavior afterwards, right? So we don't really concern ourselves with any of that, discharges or anything, but if you identify as a woman veteran from any era, we're happy to serve. We also do some work with military spouses, with service members with PTSD. And the long and short of it, if anybody reached out to us, we'd certainly get them help. So a male veteran says, hey, I need some help, we're not gonna turn them away, we'll refer them, but it's sort of hand them off, if you will. Did that answer your question?
Yeah, that's great. Yeah. What kind of work are you seeing with the military spouses?
So with military spouses, there's a lot of gaps in mental health support for them for a couple of different reasons. One, if your service member has some pretty severe PTSD, they can't work. Even if they're getting VA care, that's only however often it is. So in the meantime, between appointments and stuff, you still have to care for that person, keep them safe. A lot of the service members with PTSD we've encountered have very severe symptoms. So that's sort of a full-time job doing that, plus taking care of children, plus working a job to provide income. So they have no time, mental space, they're just worn to a frazzle at the very end. We found peer support can be very helpful for them. But there's also a major childcare issue because they often need childcare in ways that are non-traditional. In summary, the military spouses just have very little resources they can get to support their own mental health, their own physical health, and their own just time off from the constant stress of trying to keep the service members safe or cared for and their children and so on.
I see. And you provide the peer support opportunities? for that?
There are some great organizations doing peer support. And so we refer them to those peer support groups. We help them find peer support groups. We don't do the peer support ourselves.
Okay, thank you. All right. Daryl, you're at the VA, could you explain more about who all you're serving as well?
Well, yes, but we actually do serve, of course, all military. We also do serve current soldiers, I'll say soldiers because I'm an Army guy, but military personnel. When we do our intro to whole health, family members, caregivers, whoever, they can all come and see all that's available. But of course, it is a VA program. Most of the people that's in it are in the VA. And so once we start doing the other services, like any of our modalities that the VA serves, they of course they have to be in the VA healthcare. But as far as the educational part, anybody who served or anybody who cares for a veteran or family members can join the class. And just to piggyback on something that he was mentioning about support for caregivers or families, the VA does have caregiver support. They just have to fill it out. And in some cases where it's actually a financial burden, the VA can actually give the caregiver extra money. But regardless, they have a support group. They have meetings, they have educational parts. And that's part of whole health too, is sharing all those other programs that we have. Because whatever helps the veteran holistically is really important. So.
Yeah, that's great. Jackie, you've kind of touched on, you serve everybody.
Yeah.
Could you kind of expand more on that? Do you have opportunities for like services for caregivers or people that are families of the people that you're directly serving?
So our grief department has quite extensive services. So we do offer grief support for people, one-on-one counseling for people whose loved one has died on our service, but we have grief support for everyone in the community that's available for anyone, no matter how their person died. And that does a lot of different connecting grievers with grievers, which is a really important thing. And then our grief department is also available to anyone who calls in. If we can't help you, we're same with you, like we can look for ways to help people. We can refer them to other things in the community to get them some help. And we do have social workers on staff who can help a lot with caregivers. So when people call in and I used to get this a lot. I worked in a different department where I talked to people and especially spouses who would say, but I need more, but they were in the military, and it's kind of sad. We'll get to that later, I guess, with the gaps, but sort of that gap of, well, but I need more help. What can I do? And I recognize that still as a gap for a lot of people, but we are trying to do more in terms of getting people set up with resources in the community. So it's just great to find out what other people are doing, since none of us can do all of it. So yeah.
Yes, exactly. That's why we're here.
Yeah.
Yes. And Talia, could you expand more on who all you serve, including if it's families, reservists, National Guard? Yeah.
Yeah, absolutely. So we currently serve all veterans and service members, regardless of branch, regardless of era, discharge, deployment status. You tell us you're a veteran service member, we'll help you. We are completely independent, so we don't report to the DoD or the VA. And all we ask for eligibility wise is to be at least 18 years old. And we currently are serving 17 states while we expand throughout the years and months. And right now, our primary focus are those 17 states, which I can share at the end. But for the purposes of this conversation, North Carolina being one of them.
That's awesome. And do you serve the families as well?
So we do have the ability to assist what we call third party. So if a loved one calls in on behalf of their loved one, we'll connect them to resources as well as share a referral link to hope that their loved one will eventually reach out and call us to get assistance through our program. But we do not cold call clients or, potential clients or veterans on behalf of their loved ones.
Okay, thank you. Okay. Back around, Daryl, what is the protocol for somebody to receive your services?
They can just either go on our website, there's a really simple form that they fill out that is more or less their name, their phone number, email address. And then, a box for what the issue is, what they need help with. And, or they can email or they can call by phone. And then we get those in, we immediately, within a few hours, call them back or email them back, depending on what they said their preferred point of contact was. And then we sort of interview, get all the details we need. And then we start, looking for resources or provide counseling on the spot, whatever it is. And then we follow up with them every 24 to 48 hours, depending on, what their support needs are. We also try to do a warm handoff, so we don't typically say, hey, here's a list of websites you can check. We make those contacts for them, try to pre-screen, go through any pre-screen process if necessary, et cetera, so that when we are handing them off, we've already sort of done our due diligence. When it comes to things like financial support, there's less we can do there because they usually need a whole, list of private information about income and socials and all that stuff. But we try to at least pre-screen, because when you're talking financial support, usually there's sometimes a staggering list of requirements that have to be met before somebody can get money for support. So we try to do a lot of that work for them.
Okay. So we're gonna include everybody's websites in the follow-up email to make sure that they have the right information. So thank you for providing that. So you see most of the time it's self-referrals to you?
Yeah, it's almost always that, self-referrals. I can't think of another referral that we've gotten recently, but yeah.
Okay, thank you. Daryl, what is the protocol for someone to receive your services?
Well, it's pretty simple. You go to va.gov /whole health. And no matter where you are in the country or with other places that we service, once you go to va.gov /whole health, you can scroll down and they have a kind of search engine. You can find the closest VA hospital that offers whole health. And you can reach out to what we call the pathway team. Pathway team is the team that gets veterans into the whole health program. I work at the Durham VA. We have a number on there too. You just call to get in. And I guess the simplest way, if you're at any of your VA appointments for anything, whether it be your primary care, specialty care, mental health, you can just ask any of your providers. I used to say, hey, can you tell me something about whole health? And they'll give you a referral to the whole health team and we'll explain it to you and get you kind of rolling so that you can start taking advantage of those programs.
So if somebody in the room wanted to refer someone to your services, would we direct them to the website or to your email?
So if they're within what we call the Durham catchment area, which is from Durham Hospital all the way down to Morehead City, they can call Whole Health directly. I have flyers, I can give everybody the number. But if they're outside, because we service North Carolina is broken into 4 different parts as far as catchment areas with the Fayetteville and Salisbury, Hampton, and I forget the last one because I got CRS. But anyway, you would have to call that hospital to get into there. But anybody can come to any of the classes. And as far as the whole health education part goes, I know that some, depending on what you're rated in this VA, some people have to pay different parts for VA healthcare, but all the educational part of VA health, whole health is there's no charge for it, no matter what your rating is.
All right, perfect. Thank you. Jackie, what is the protocol for receiving your services?
So a good majority of our referrals come from doctors. So we have people who have met with their doctor, they're seeing them for whatever is going on. It's typically a serious disease, a chronic illness. But people can just simply call in. We can take self referrals, we can take family referrals. We have an intake department that has got social workers in there, and they will literally just walk somebody through, what's going on, tell me what's happening, what do you feel like you need, what can we offer you? We are always happy to send out, particularly if it's a hospice situation, where if somebody's just saying, I'm not sure, could you come out here? We will gladly send a nurse out to do an evaluation and talk them through that process. There was one other point I was gonna make. Oh, and so we also have palliative care doctors in all of the wake meds. And we encourage people, if you're forever in doubt, you can just say, I'd like a palliative care consult, but we do have those doctors embedded there. So they're seeing the patients that are sort of coming through pretty frequently. So if we have people who are coming through the emergency room, and I can tell you, taking care of my dad, I had him in the emergency room a lot because I didn't know what I didn't know back then. And it was just me a lot saying, no, let's go back to the ER. And that they try to sort of stop that cycle of saying, hey, let's talk about what we can do to get you set up once you get home. So,
yeah. Is there any kind of wait list?
no.
Oh, that's wonderful.
Yeah.
Okay. So how would anybody in the room go about like directly referring someone that we're working with?
So we call our main number. So we have, and it's on our website, and I've got some flyers here. We do have a human being that answers the phone 24 hours a day. So intake and referrals are sort of, business hours. They can handle them during those hours. But if you call any time of day you call, you get a person that then can connect you with whoever you need. So
Okay, that's wonderful. Thank you.
You're welcome.
All right, and Talia, how does someone go about receiving your services?
Yeah, we have two ways if somebody can reach out to us. So you can go to goroger.org and fill out our help request form. It asks for contact information, some demographics, things along those lines. And at any point, someone can just hit submit, and even if it's just filling out their name and phone number, and someone will reach out to them. We also have our 833-24/7 hotline. That's 833-MY-ROGER that they can call. Someone will answer the phone, fill out the form with them on our end, and then they're getting a call from our team within 1 business day, and getting a call from our call center within minutes if they're reaching out via web form.
Okay. So if we want to refer someone to you, would we give them those numbers? Would we call with them? What would be the best
Either
way?
one. Either one. So you can hop on a help request form and provide them the link right then and there, or provide them the Roger phone number, and communicate with someone via phone.
Okay, perfect. Thank you. So I'm gonna make sure I get all the phone numbers to include on the email, because I have the websites, but I want to make sure I get those phone numbers in there as well to make it easy. And my last question for the group, Dr. Roberts, what gaps or struggles are you currently seeing that we can all work together as a group to help minimize?
Yeah, that's a great question. I don't know how much we can do as a group, because it's pretty sticky, but I'll give it to you anyway. I've been running into a lot of issues with women veterans who need financial support. The problem is either, and there are a number of organizations that do financial support, but the requirements can be hard to navigate. Either there's a discharge requirement, in other words, you have to have an honorable, you have to be post 9/11 and have certain disabilities. You can't have beyond a certain income. So I've been talking to women veterans who are pre 9/11 era. They don't have enough, they served, but they don't meet these requirements. They have too much income, but the problem is they also have a ton of debt, and they have like some other issues that happen, because life happens to people. Sometimes you can get debt trouble, you don't mean to, you get a bad health thing, or a business fails or whatever. And so literally almost no financial help for them, even though they're just as desperate and in just as much need as anybody else. And so that's a huge gap that I mean, all these nonprofit groups and where everybody's, fighting for the same dollars and stuff. So, but it's just those few things that I mentioned. have become obstacles for many of the women that I'm talking to, and it's really tough when you're saying like, we don't have enough funds, and I've scoured, I haven't yet found a funding help for you. And you know, sometimes they're in danger of being homeless. So, you know, we could look at the requirements. Are all these requirements really necessary? Do you really have to have an honorable discharge to be in financial need? No, you know. It's a lot of different things to look at, plus just more money in general to be available for women that are.
Yeah, yeah, I'm gonna pass it over to Ally to speak real quick.
Yeah, so you're absolutely right. The biggest gap there is for financial support for veterans that we have seen is this pre 9/11, less than honorable, no combat veterans. So out of curiosity, is there a specific area of need, like rent, utilities, food assistance, car insurance? Like, what's the biggest need?
Well, I'll give you two examples. One, lady I just talked to this Friday, and she needed rent money to stay in her place. And she had gotten behind because she had spent a lot of money to help take care of her father and other things. So she was getting ready to lose her apartment. So that was like rent, utilities, that kind of thing. But another woman I talked to, she had a lot of mental health challenges she's working through. She had a really good care team. After the federal government stopped funding a lot of things they were funding before, her care team said the cost is going to now double for you to be able to get care. And so there's a lot of free mental health care out there, but she didn't need a new team. She had been working with, she had a care team of several people she'd been working with for quite a while. She's very happy with them. So it wasn't, you know, the idea of like, hey, lose all those people and get the free stuff here wasn't, so it was just, she had enough money to pay rent and so on, mortgage, whatever, but not enough to be able to get the care she needed. So that was the issue of, you know, $1,700 a month, or I think is what it was. What it went from $850 to $1,700 a month to get the care that she needed. I think those are the numbers. I'd have to look again, but again, there's really nothing out there that we could. My best suggestion was maybe if you could apply for support and like shift your budget a little bit so that you're paying for the care you had to have, but now you're short on mortgage, and try that. You know what I mean? Just, but I don't, like, I can't do that for her. So, you know, as far as I know, she, and you know, so anyway, does that help?
Yeah, the second situation is incredibly hard. I am extremely short on resources for healthcare debt or that kind of situation. But there are organizations like the Gary Sinise Foundation, Tunnels to Towers. I'm sure there's people in the call that are very familiar with those organizations.
Yeah, and I went to all those.
And a lot of them are post 9/11.
Yes.
That's the biggest battle. I will say that you know, our Operation Vessel program does accept pre 9/11 veterans for those in the triangle. I can definitely get you more information.
Yeah, I would love that.
Yeah, absolutely.
The other issue was related to care was psychiatric medicine. Because this other veteran, she was sort of in a battle with the VA, right? Some kind of legal battle. So she couldn't use the VA resources and she needed PTSD meds and stuff. But I did talk to somebody who helped me have some potential avenues for her. So that might have been solved, but that was, again, like sort of a unique situation in the sense, this is not about counseling or mental health, it's about medicine, you know, so, but we may have had that one solved.
Yeah, those are tough. But hopefully, having Ally's contact.
Yeah.
Yeah, I'd love to get you some more information about some ideas.
Daryl, what are some of the gaps, that you're seeing?
I think the biggest gap is kind of what they were talking about is, I'm not saying financial period, but I'm saying, it's just knowing all the resources that are available. Because there's so many programs that have different criterias and just knowing, what each person's situation is and, finding the right program for them. Because, you can find them, it's just so difficult to find them. And, I remember it was Asheville, that was the other. Well, yeah, I think that's the biggest gap is, just trying to find those resources for, all the veterans. And, for example, the VA, we do have that, you can't have a dishonorable discharge. But there's so many different programs that do support our veterans, and especially with mental health. The VA does have a lot of programs for mental health, whether you're attached to VA or not. And when I come to the VA, and I'll start with this, is we've just recently had a meeting, and only 40% of veterans that are available, that are eligible for VA healthcare actually use any VA healthcare. Wow.
Is that a national average or a local?
I believe that's North Carolina.
That's pretty close to the national average, so.
Okay.
Yeah, we hear that all the time, is that people just don't know it's out there, and that's a huge gap, is like, how do we get the right information into the right hands? Without it just being like a daunting list of resources, because that doesn't help anybody. And just doing Google search, like you've given so many options, so like, what do you know is actually there available for you without doing hours and hours of research, looking at the criteria? Yeah.
Yeah, and that's if you're struggling, you're depressed, you're whatever, right? You're having you're not gonna, it's that much harder to even Google search, and then and just feeling like there's nothing, especially if you've been told by a couple of organizations no. And then, so anything we can do for them to just, give them some assurance, and then be able to say, we're gonna, help them. And I'm sure you all do that, so.
Yeah. There's a quote I saw on LinkedIn recently that said we need to stop handing veterans a list and start handing them a team.
Yeah.
Because to your point about the warm handoff, like, handing people who are already overwhelmed a list, be like, make some more phone calls. Yeah, good luck with that, press 9, press 8.
I'll pass over to you, Jackie.
Okay.
What are some of the gaps or struggles that you're seeing currently?
So some of the main ones are, I think across the board in healthcare. For us specifically, there's a lot of stigma, taboo around hospice, end of life topics, palliative care. People don't want to talk about it at all, or think about that. So, we try to do a lot with advanced care planning and sort of helping people to learn more about that. So that's a problem, but also I think just a real, sometimes a mistrust in healthcare, and helping people to understand more, sort of build up better relationships so that people feel like they can trust, what's going on. Yeah. That's pretty much it. Yeah.
So how can we in the room kind of help break the stigma like around hospices, like having like these kind of talks?
I think it is. I think, we try to get out and do a lot of education, but that we come in and sort of do it with advanced care planning. So that's something that can be done at any age, and that's appropriate and important for people at all ages. And we have this game that we play called the Go Wish cards, and it helps people to start to talk about some things that are a little scary, but it gives words, like, instead of saying, let's talk about hospice, or why don't you tell me what's important to you? This is a game that you play, and it just gives you some thoughts about what might be important to you. And then you play with another person or just for yourself, and you take a picture of it, and you have this sense of, oh, and if I was playing with you, let's say you were my daughter, and I'd say, wow, I didn't know. You felt that way about that. You'd be like, Mom, you want to go to the hospital to die? I thought you wanted, so some of those sorts of things to to make it a little more approachable. Yeah.
Yeah, that's so interesting. Yeah. Did you bring the game with you by chance? No.
Oh, I actually might have one in here. Let me take for a minute.
I'll play with your mom.
Okay, yeah. So my daughter's 24 and she does, so we also have a great form called the 5 Wishes, which I'm pretty sure I don't have. That helps people to do some advanced care planning, but it's just to name their healthcare proxy and then what they want if they can't speak for themselves. And so it walks you through in a nicer way. So yes, DNR and CPR and things like that, but you know, I would like my dogs to be able to be there. So make sure you have me at home so that I can be comfortable, and make sure you're giving me a shower because I don't want to lay there dirty, and make sure yeah, so things like that.
Yeah, that's so interesting. Yeah. Like the one certain thing in life.
Yes.
But nobody likes to talk about it.
Yeah.
Yeah, that's super interesting. I'd love to see that game sometime.
I would be glad to come and do a workshop anytime. Yes.
And I'll pass it off to Talia. What are some of the gaps or struggles that you're seeing right now that we can help minimize?
Yeah, so I think right now what we're seeing as far as gaps and challenges is just making sure that we're getting in front of the right audience. We're getting in front of those clients and service members and veterans who have moderate and high risk for suicidality. So they're actively suicidal, they've recently been suicidal. And I think that comes through different partnerships and awareness of organizations being aware of us and how we can improve in our client acquisition, and then making sure clients are staying engaged. So we have quite a few clients that reach out needing help, whether that's your phone number or web form, but then don't want to answer the phone once we're calling, or staying engaged. So they get their immediate needs as far as like resourcing or start participating in a couple of sessions and then slowly drop off of our services. And so it's a game of, calling them, texting them, emailing them, seeing if they're still wanting to engage in our program. We know that suicide is a hard topic to discuss, but we want to make sure that any potential clients that do need help and assistance know that they can trust us and that we're here for them to, ultimately connect them through our clinical program.
That's great. Yeah. That's something else we hear all the time is how hard suicide is to talk about. So we're hosting an event in September with the purpose of helping break the stigma further in our area in the military community. So I'll share information about that too. But yes, thank you so much for the work that you're doing, and hopefully we can keep breaking the stigma while we work together.
Thank you.
So we're kind of nearing the end. Talia, would you like to go ahead and share your slides, and then we can finish off with Paul Berry sharing some information from NC Serves?
Actually, all my slides were laid out just based off of your questions, and I did email them over to you. So rather than share all the information again of how I answered the questions, if people have questions, they're right then and there, and my contact information's on the last page. I just emailed that over to you.
Okay, perfect. Thank you so much. So we could have Paul Berry share his data with us.
Yeah, hey, thanks. There's really good discussions here. And navigating the resources is an issue. I pulled up, this is triangle data through the NC Serves, or if you think of NC Care 360, but this is more veteran specific for the triangle over the last 5 years, but just for female veterans. It's not necessarily, but that also could be, it's a little broader than that, as we discussed. That could be survivors, widows, caregivers also that identify as female. So it's not just female women, and I filtered it to mental behavioral health services that they asked for over the last 5 years. These are the co-occurring needs that you were talking about that are data generated. 23.5% that seek some kind of mental health services also need food. I mean, 18% housing. I mean, it's just very telling. And it was good to see this panel come together to discuss that. Yeah, I think as we all know, it takes a village. But I think sometimes we have to have these discussions. So Landry and Brooke, I appreciate you having this discussion with these community partners, because I think together we have the solutions. But and that's really what it is let's talk to each other more and more to make sure that we have these solutions. And I think it was said a couple times is sometimes it feels like we're competing for the same funding, but remember, we're all serving the same veterans. So I appreciate that discussion too, is let's work together. Thank you.
Thank you, Paul. What,
and just
timeframe is that?
And just super quick, there's 2 Staff Sergeant Fox grantee participants in the state, Veteran Services of the Carolinas and VBH. We screen every veteran for mental health that comes in and then refer them. So the idea is, the intent of why we got that grant is to touch the other ones, the not the 3 or 4 out of 10 that go to the VA. It's the other ones that are touching community-based organizations like all of you in that room. Our job is to screen them and then potentially refer them to community partners, not just the VA. Of course, we would like to refer, and we do refer to the VA for enrollment or mental health services, VA healthcare, but also the community-based organizations like Stop Soldier Suicide and the Cohen Clinic and all that too. So just keep that in mind as organizations are going. If you think someone needs screened or something like that, don't hesitate to send them our way. If you don't use Unitas, that's okay. People can do a self-referral, give it a phone number or something like that. Thank you.
Thank you, Paul. I also want to give Jamie Upchurch a chance to speak about what her team does.
Thank you for the opportunity. It's interesting. I haven't actually joined this call in several months. You all probably know everyone in VA is being pulled to multiple jobs, and I've been detailed. So I did see the topic, and so I carved out some time to join. So I appreciate that. So I manage our Women Veteran program. And essentially, it's a collective unit of everything you just mentioned. Basically, I mean, my personal role is a lot of policy and procedure and strategic planning, making sure that we have the care and the resources. So when women veterans do come into VA, we have the resources available to them. Also, I heard a lot on the panel of how do we get information out to veterans to let them know what resources we have. We struggle with that a lot. We have an entire maternity care program that offers amazing services, including lactation consultant, and a lot of people don't even know that VA offers programs such as that, infertility, IVF. There's just a lot of programs and services that we offer that people are not aware of. I'm excited to hear about the moral injury. I was asking some more questions about that in the chat because we just did a focus group down in our Morehead City clinic, asking veterans about moral injury and what they would like to, learn more about. And so they're actually starting a group down there focused solely around that. So I did get the information from that group because we may be reaching out. And I've already looked at your website while you guys were talking and saw you have a podcast. So I've been stalking you while you've been talking. So
I like it.
yeah. So that's, it's nice to know that everybody's kind of on the same page and kind of that there's a lot of community partners that we can partner with to help get our veterans care. I think, our biggest challenge is, like I said, just getting veterans in the door. There's a huge stigma about VAs for men, not for women, and just how women are encountered as soon as they, walk in the door, making sure that they feel safe and welcome, and again, just know what resources are available. And so we're working hard to not only train, educate our veterans on what services are available and how to ask for those resources, but also educating our staff throughout VA of what services are available. So, yeah, it's a huge lift for sure because new services and programs are coming out all the time. Like I mentioned, IVF, infertility. A lot of people don't know we offer those things, and how do we get that information out? I've been working with our public affairs team. National Women's Health Services has done a really good job of putting out new brochures about different, conditions that we support, but also information about different services we offer. So I'm trying to work to get a lot of that more on our front-facing VA page, so veterans can at least see those brochures and know that those things are offered. So yeah, more to come, but happy to be here and thanks for the conversation.
Thank you, Jamie.
Yeah.
Hey, what are some of the chat questions we have?
Oh, I've been following. We just had a few asking for like website stuff.
Okay, perfect. Yeah, and that'll all be included in the whole email. All right, do we have any questions from the group for our panelists that haven't already been answered? No? All right.
She's, nice, raise your
Sorry, I
hand.
raised my hand.
Yeah.
Couldn't find the button. I would just love to know, so at the North Carolina Institute of Medicine, we are starting a task force on veterans health, and actually Paul is one of our co-chairs for the task force. And I would love to know from the panelists or others, what are some kind of solutions that you see either from your work that you think, if we made this change, we could really serve veterans better, or maybe you've seen it in other states.
In reference to a particular type of care or just in general? Or?
Just in general, because you all represent, a big variety of services.
Yeah, I think for me, we have to get rid of the discharge piece. I mean, we just have to, what kind of discharge a person has, especially if they're a woman veteran, and you probably can't do it just for women veterans, but you just have to get rid of that as a requirement to get care. Because even if a person had a discharge that was less than honorable and they really deserved it, right? They probably need a lot of care because of stuff. So that's just it. That's for me, get rid of that requirement. Because I don't think it's necessary. And I think it is a barrier for a lot of women who really need care or support.
Just one thing that I noticed that's real helpful in the VA is they really started focusing on health coaching. And coming up with shared goals between their primary care and what's important to the veteran. And that health coaching has really been super helpful for a lot of veterans, struggling with all different whether it be physical or mental. Health coaching is one of the things that I advocate for all veterans, that they should give it at least a try. It's awesome. And I just want to say that we talk a lot about women's health care. If anybody can go down or is down near the New Bern area, they're doing women's veterans outreach down at the New Bern Convention Center down by the riverfront this Friday. So if you can make it out there, there's a big a women's health thing going on.
Carla added into the chat really quick, and then Ross, you're up. Accept veterans no matter what era they served. That's I get on that bandwagon real fast.
Me too.
Yeah. Make the process not one where the veteran has to jump through hoops to join. Yeah. Those are both really good. Yeah. Thank you, Carla. Ross?
Yeah, I too could not find the raise hand button. So did Zoom do something different? But actually, this is a question for Paul. I'm really interested in the chart that you showed and then dropped in the chat. Is that open source or because I'm really interested in the correlation between these factors, and you chose mental health and food security, but I'd be curious to see what the other dimensions say as well.
Yeah, well, I'll drop my my email in the chat, but it's not necessarily, I would say, open source. It's through Unite Us. You got to be like a frequent Unite Us user where you get access to what's called their Insights dashboard, and then you're allowed to pull that kind of data. But I'd be happy to connect with you for sure, Ross.
That sounds great. Thank you, Paul.
Yeah, thanks.
See, now you know someone on the inside where you can get it. See how that connection works?
I love it. Yeah.
Any other questions?
All right, do we have any, you mentioned an event, I just found it and I just added a link in our follow-up email. Do we have any other events or news to share with the group?
I do want to share that we got a grant to, we're producing a moral injury guidebook for women veterans. It'll be published by the end of the month, and we got a grant. We can send that for free to women veterans. So you could just email me. Even if you're not a women veteran, but you work with groups of women veterans and whatever, you can email me and we can send those books out. They'll start going out July 1st. But yeah, so.
Yeah, that's awesome. Awesome. Put that in here.
So we have the Women's Veterans Honor Walk Saturday from 10-12. It's gonna be at the Veteran Memorial downtown Raleigh. Secretary Millette, she's gonna be and Savon, Secretary Millette, NCDMV, and Savon Norris, VSO Director of Wake County. She's gonna be hosting the event. So I know it conflicts with recon, but at the same time, there's a bunch of events going downtown Raleigh. You know, just err on the side of caution of what you do and how you do it. But if you have time, try to hit both events.
What time is it?
It's from 10-12.
See,
As soon as recon ends.
Yes.
Yeah, no, as soon as
They
you
can go
leave.
from here to there.
Yeah, it'll be
But you
fine.
know, that traffic is gonna be crazy, you know, so.
Is that Charlotte Millette?
What's that,
Is
sir?
that Charlotte Millette, the name that you mentioned who's?
Wait a minute, is it, let me see, it is. Let me get it pulled up, I ain't got my glasses on. Jocelyn Millette.
Okay.
We had received a grant recently to be able to do a lot more advanced care planning workshops. So please, if anyone at any point is interested, we would love to come out and do workshops like that. And also, we just finished producing a film about serious illness and end of life, aimed more towards the Black and African American community and Latino community, because that's where we're trying to help build a little more trust, a little more information. We're doing a film screening next Wednesday. So I would love for anyone who would like to come, if you, I can send the invitation to you, if you want to send it out. Yeah, that'll be on our campus. We're in person, got food and showing the film and just doing a short discussion after that, so.
Perfect. And what were your workshops called?
It's just advanced care planning. Yeah, advanced care planning.
Perfect. That's awesome. Congratulations on all these grants.
I know.
I'm very glad you all are getting funded.
The big one we're waiting for, not sure, but. Yeah. Be what it'll be.
Are there any updates from online?
Hi.
Hi, Patessa.
Hi, my name is, for those that don't know, my name is Paitessa Buffet. I'm the outreach coordinator for North Carolina National Guard. I apologize for coming online late. My intent was to attend in person, but unfortunately some stuff happened that I had to be here at the office. One of the events that we have coming up is the North Carolina National Guard Military and Veteran Partnership Program or meeting. That is a event just like the VFMA, but is more like for the National Guard and the Reserve component. We bring resources together, like in the area, like usually bi-monthly we go from the central part of the state to the western and to the eastern part of the state. Usually we meet at a armory, National Guard Armory, or a readiness center. For the Army Reserve, this time is going to be in Hickory on the western part of the state, and it's going to be at the Readiness Center there, the Army Reserve Center. So I can share more information for that, but we just get together. We have unit representatives as well, and just kind of talk through the issues and connect with the resources that can support one another, as well as the service members and the unit locally there in the area.
Yeah, so if you have not attended one of these meetings, they are amazing. There are some fantastic resources present at those meetings. So how do people register for that? Would they email you?
Yes, I will share the flyer with you, and then they will find the information there. But usually you just because it's a roundtable conversation just like this, so I like to keep it more small, so I know how many people's not small in a meaning of no registration required, just an email to me.
Okay, perfect. Yeah, we'll have that in there.
Thank you.
Awesome. Anything else from online? Okay, well, Joel has a few things coming up. Like Antonia mentioned, this Saturday is our first recon event. This is going to be a resource connection event specifically focused on veterans benefits. So we're gonna have the Veterans Benefits Administration there, as well as Wake County Veteran Services. And they'll be there to answer any questions about benefits. We're gonna have a vendor portion and then a group discussion portion where we can kind of get into the nitty gritty about it. So we have our flyer here. I'll include the flyer on our follow-up email. We'll have breakfast and coffee available as well, and that'll be a great time. Our next VMFA meeting is going to be our Veterans Housing Symposium. So this will be an extended VMFA meeting starting at 11:30 and going until 2. We're gonna have another collaborative portion on this, as well as some panelists to discuss various housing topics. So that'll be a great one. Y'all don't want to miss that. That'll be a lunch as well. But I'll include all this information in here. And an exciting thing is that our Operation Art workshops are still open right now for the summer. I'll include the link in the email, but for those that do like social enrichment, those are great. They're just one day or some are 2 days. But great opportunity to get out and do something funky. Yes.
Yeah, we still have a couple spots in almost all the workshops actually. So we have one this weekend, one next weekend, almost every weekend this summer, as well as a couple throughout the week as well. So reach out if you have any questions or are just interested in learning more. Happy to answer any questions.
Thank you, Isabella. Okay, so this will wrap up our June VMFA meeting. Thank you all for being here. I want to, recognize our panelists again for coming out. This was a really fantastic conversation. You all offer really amazing resources. So thank you for being here. And thank you for those that joined online.
Thank you.
Bye, everybody.
Thank you for having us.